Hello, I am Dr. Priya Timothy, the glaucoma specialist at Zamindar Microsurgical Eye Center, Kalyan Nagar, Bangalore. Today I am going to be speaking on a topic called low vision assessment. When do we call a patient having low vision? Low vision is a diagnosis made when the regular eye checkup with the glasses or contact lenses or surgery is unable to improve a patient's vision. A patient with low vision is grappling with managing activities of daily living. They need help in all their activities and they cannot be independent. In a routine eye examination, the doctor is able to examine the eye and give the prescribed spectacles or contact lenses to improve a patient's vision. But in low vision assessment, it is much more than that. We need to actually find out from the patient his or her needs, what he does every day, his difficulties that he has, what tasks he is not able to perform because of the low vision. So, for example, if you had a glaucoma patient, they have tunnel vision towards the end when they are not able to see the periphery. So, we need to give them help in that. Then if it is a child who has a congenital visual problem, we need to give them aids to help them to perform in school, in reading and looking at the blackboard. If it is an IT professional, we need to help them in using a laptop or a computer. If it is an old person who is alone at home, we need to help them to be able to move around their house, get to the different rooms, walk down steps, and some of the elderly patients would want to read. They would want help in reading the newspaper. Some housewives would want help in working in the kitchen, chopping vegetables. So each population of people with low vision need help in different aspects. Low vision aids are particularly useful for patients who have glaucoma, as I mentioned before, who have lost their peripheral vision. Then in patients who have central field defects, like patients with age-related macular degeneration or those who have scars on their retina, maybe consequent to diabetic retinopathy. Then we have patients who have retinitis pigmentosa or night blindness. We have patients who have had an injury or have scars on the retina, and we also have patients who have maybe had a stroke or a surgery following a brain tumor. These are different individuals. It would help them to have low vision aids. So the thing is, this assessment is individualized. So we have to make sure that we are focusing on the particular patient's problem and trying to solve that. So when we call a patient for low vision assessment, we must have enough time to do the same. We first take a detailed history from the patient and the caregiver if required, and we ask them to bring whatever material they want to read or explain to us the task they do so that we can help them in day-to-day activities. At the end of the assessment, we are able to advise them on which aids would be useful for them, and that I will be speaking of later. Even though low vision assessment is a very laborious, time-consuming process, it is worth its while for a patient who needs help, and it is very useful for people with low vision.